On this episode, 2 medical mysteries that defied the experts.
I was freaking out, just completely beside myself with pain and just worried. What is going on?
Tammy Gilliland's life begins to spiral out of control when a horrifying condition stops her dead in her tracks.
I couldn't feel my legs. From the waist down, I couldn't feel at all.
She was hooked up to heart monitors and oxygen, and we were scared to death at that point.
Then, Nadine Miller is the picture of perfect health until her vision begins to rapidly deteriorate, and no doctor can tell her why.
I felt like I lost control. My vision is going out.
It was very frightening. I was terrified.
I felt that no one believed me. You think, God, not me. Am I going blind?
In the fall of 1998, Tammy Gilliland had just graduated from college and was thrilled to be starting a life of her own in Springfield, Missouri. Even more exciting was the fact that she and her sister Julie had just moved into their first apartment together.
Julie and I are such great friends, and we're just so close.
Tammy was in a position at a bank. I was working for a small newspaper. We were very excited to be on our own and having somebody that we could trust to live with.
I would end my day at 5, and then I would have plans every night. I always had plans to, meet a friend, go to the gym, go to the mall shopping, babysit a friend's child. I mean, it was constant going, which I loved. That was just part of me. I'm just extremely energetic and always on the go.
Tammy and I had so much fun living in Springfield. We were very social with the people that we went to church with.
We would have people over for dinner parties at our house, entertained a lot. Just kind of the regular, sister hanging out stuff.
As Tammy juggles her busy schedule with ease, she has no clue that everything is about to change one chilly day in November.
I was starting to feel so fatigued and tired, and it was so unusual for me. Something was making me so exhausted.
The way Tammy described how she was feeling, it sounded like maybe she had the flu.
It progressively got worse to the point where I felt completely debilitated and exhausted. Like I did not even want to get out of bed in the morning.
She could get through work, but then she needed to come home. She needed to go to sleep. She went into almost like hibernation mode because she just didn't have the energy.
I finally was like, I've got to go in and see what's going on because this is just not normal. 4 weeks of just complete exhaustion without ever getting over it. So I went and I saw the doctor. They did a blood test because they thought possibly there was some virus related to this. And they found that it was mono.
Mononucleosis is a viral infection that causes fever, sore throat, and extreme fatigue.
Which explains why I felt so bad for so long. Mono was what was causing all the fatigue initially, the achiness, just, feeling crappy. She told me to go home and get some rest and drink a lot of liquids.
Tammy took the doctor's advice. She got rest, she drank lots of fluids, but she was still just not feeling like herself.
While Tammy follows the doctor's orders to a T, there are no signs of improvement. And just 2 days later, a bizarre new symptom suddenly emerges.
I realized I had not been able to go to the bathroom all morning. So I go in the bathroom. I'm back there for like half an hour, and I just cannot go to the bathroom. It's very painful at this point because I need to go, but I can't actually make myself go. Water running, toilet flushing, nothing could help me actually urinate. And I called the doctor's office, and they were able to get me in that afternoon. I got to the doctor's office, and I told her that, I can't go to the bathroom. I need to urinate, but I can't. So the doctor says, let's try all the usual things. I'll bring you some water. I was in this room for about 3 hours, drinking water, can't go to the bathroom. It was just this completely foreign feeling of just pressure and just almost kind of like a desperate, anxious feeling. It was very uncomfortable. And she said, let's go ahead and just catheterize you.
A catheter is a thin, flexible tube used to drain fluid from the bladder.
Once they catheterized me, it was literally just instant relief. The pressure was gone, and I felt like, okay, I can cope again. They do an immediate test in the office to see if they see infection or blood cells in the urine, and she believed that it was a bladder infection. I had had bladder infections before, but never had any symptoms like this. Nothing like this. She gave me a prescription for an antibiotic. The doctor also told me, get soup on the way home, drink just as much liquid as you can get, and flush this infection out of your system. I wasn't sure what to think. I definitely was raised that, when a doctor tells you something, that's just the gospel, and, okay, I must be overreacting. I need to go home and get some rest and drink a lot of liquids. So I leave the doctor's office and I get like a quart of soup and a large soda, and I get home. I drink the entire soda. I drink all of the soup. I drink several glasses of water on top of that. So I am just sure that I'm going to be able to urinate following all of this liquid.
But as the hours go by, Tammy still isn't able to relieve herself.
I was pacing back and forth, just feeling so much pressure. It was much worse than it was earlier in the day because I had drank so much liquid. It was just unbearable. By this time, I'm so desperate and absolutely panic-stricken that I can't go to the bathroom. I was in so much pain, I can't even stand up straight.
Tammy called me, and she was so upset. She couldn't even get the words out. I mean, she was crying because she was hurting so bad.
I said, Julie, I can't wait any longer. This is a total emergency. I have to go to the emergency room, and I cannot drive myself. Please come and get me. She left work immediately.
Tammy was almost doubled over in pain. She looked kind of like a freight train hit her. She was in rough shape.
I am starting to feel like it's an emergency, like there's something really wrong. I was so uncomfortable. I was freaking out, just completely beside myself with discomfort and pain and just worried. What is going on?
So we went to the emergency room immediately.
We arrived at the hospital, and I described to them how much pain I was in and how much liquid I had ingested that afternoon. So they catheterized me right away, and they took out about 1 liter of liquid. That's a lot of liquid. They were totally astounded. That is probably about 4 times what would normally ever be in someone's bladder at once.
Next, the ER doctor begins performing a round of tests, hoping to figure out what triggered the incapacitating episode.
They tested my urine at the hospital, and they said, we don't see an infection there. We don't know what's causing the problem. So they left the catheter in and told me to see the urologist the next morning.
I drove Tammy home after she had gotten the catheter, and she was so upset.
I'm a completely healthy 25-year-old active woman, and all of a sudden I have a catheter in. I was fine, and now all of a sudden I can't go to the bathroom. It was embarrassing and just completely foreign to me. I was so exhausted that I felt like I couldn't even pick up my feet, and I just went to sleep.
I called my parents, and I told them to stop whatever they were doing. They needed to pack a bag, and they needed to come to Springfield. Right that minute, Tammy was really sick. I was trying to, maintain and say, we're going to find out what it is. Mom and Dad are on their way. Don't worry, we're going to get through this. So I tried to keep her as calm as I could.
It was scary because I don't think Julie would have been the type to panic had it not been a really serious issue. Then we just packed up within an hour. We were in the car headed for Missouri. The drive from Denver to Springfield was about 14, 15 hours straight through. When we arrived at their house, she was just out of it. I don't even know how to describe it. She was in bed and so sick, and her bladder wouldn't work, and she was frightened.
Mom and Dad took me to the urologist. The doctor examined me and took a sample of urine from the cath bag and cultured it and said, again, no, we don't see an infection. He told Mom and I that he's never seen a healthy 25-year-old with a bladder infection not be able to urinate. He was like, that is not a normal symptom of a urinary tract infection. The urologist wanted to examine me more thoroughly, but he wasn't able to because my bladder was so stretched out from all the liquid that I had been retaining. He was going to have to just see me the next week and do the exam when the bladder had returned to its normal shape.
With no choice but to wait yet another week for an answer, Tammy schedules a follow-up appointment with the doctor and heads back home.
When we got back from the urologist, Tammy was so sick and tired that she could not climb the stairs. The last flight of stairs, she crawled on her hands and knees.
I just wasn't able to physically walk. I didn't have the strength to make it up the stairs.
It was terrible. It was horrible to see her like that.
Exhausted, Tammy climbs into bed to rest. But it's not long before a terrifying new symptom sets in.
Tammy had said, I felt tingly. And, of course, we were like, tingly, what does that mean?
The tingling felt like pins and needles, and as it came up my body, I would have this sensation of tingling, and then below that would be numb, and above that would feel normal. It was very uncomfortable feeling. Slowly that weekend, that tingling feeling just started creeping up my legs. So, on Saturday it was up to my knees, and on Sunday it was up to my hips. I woke up that Monday morning, and I started to get out of bed, and I just immediately collapsed on the floor. I couldn't bear my own weight. I couldn't feel my legs. From the waist down, I couldn't feel at all.
We heard Tammy fall. She was trying to get out of bed, and we heard her go down.
They heard me hit the floor, and they ran in immediately, and I told them I cannot feel my legs.
She couldn't use her legs. She couldn't get up.
We were all terrified. I kept thinking to myself, I can't feel my legs. I can't feel my legs. Just panicking, I can't feel my legs.
For the past 4 days, 25-year-old Tammy Gilliland hasn't been able to go to the bathroom. What her doctor first believed was a simple case of mono has taken a terrifying turn for the worse, and now she can't feel or move her legs. In a state of panic, her mother and sister are racing her to the hospital.
I remember collapsing, and then I don't remember anything again until being in the hospital.
I don't even know. It was such a scary time.
Dr. Laurie Mcpherson, the on-call doctor, immediately takes over Tammy's case.
When I met Tammy for the first time, she was too sick to really give much of her own history. I went ahead and did my own exam. I found that she had no sensation between sharp and dull from her feet up to her nipple line. She basically had evidence of paraplegia. She was unable to lift her legs, either one of them on her own.
I remember her touching my feet and my legs with all kinds of different objects and doing reflex tests as well, but I don't remember feeling anything, like having zero sensation below the chest at this point.
I thought, wow, we have something rapidly progressing. She's declining. My next step was to order an MRI of the central nervous system.
While Tammy is wheeled off for the scan, her family waits anxiously. Nothing could have prepared them for what the images reveal.
The results of Tammy's MRI showed significant brain lesions throughout her central nervous system. The brain lesions were indicative of multiple sclerosis.
In multiple sclerosis, the body's immune system attacks the nerves of the brain and spinal cord. As a result, muscles weaken, and in severe cases, patients become immobile.
My husband and I were both worried that Tammy would be paralyzed. That's what we were fearing.
When Dr. Mcpherson mentioned the possibility of MS, I immediately started thinking about how life would change for Tammy and I. I definitely thought that Tammy was going to be in a wheelchair.
It was hard to emotionally cope with the severity of it.
The next step was to do a lumbar puncture, which is a tap of the spinal fluid. In the cerebrospinal fluid, we can test for blood counts and protein levels.
The next 2 hours are almost unbearable as Tammy begins to consider living with the incapacitating disease. Finally, when the results are in, they're nothing short of shocking.
The results of her spinal fluids did not show any evidence of the normal things that we would find with multiple sclerosis. And at that time, I diagnosed her with acute disseminated encephalomyelitis.
Acute Disseminated Encephalomyelitis, or ADEM, is a rare neurological disorder that's often triggered by a viral infection. Normally, when a virus enters the body, antibodies spring into action and fight it off. But in patients like Tammy, the antibodies go haywire and begin to attack the brain and spinal cord. As a result, various systems in the body begin to malfunction.
Acute disseminated encephalomyelitis is a response to a virus, and the person's immune system overreacts and attacks its own central nervous system, the brain and the entire spinal cord.
I had no idea what the disease was. I didn't know anything about it. It was totally foreign to me.
I don't know if the diagnosis was a relief or just further worry. It sounded really bad to me. Not knowing anything about it made it sound worse.
As the family struggles to understand Tammy's condition, Dr. Mcpherson explains how all of her symptoms are linked to ADEM.
Her initial illness was mono, and that included the excessive fatigue that then led to the immune system response, which resulted in this disease process. The ADEM specifically attacked some of the nerves from her lower spinal cord that controlled her bladder. This resulted in her being unable to urinate on her own and actually caused the legs to become paralyzed.
And then it eventually triggered this reaction. So as the disease progressed, it started at the very bottom of my spinal cord attacking these nerves and then just worked its way up.
It was such a relief for the disease to have a name, for us to know what was going on with Tammy. But I wanted to know what the prognosis was. I mean, is Tammy going to be okay? That's all I want to know.
Acute disseminated encephalomyelitis is a critical illness. It's an ascending paralysis from the feet up, and once it reaches the muscles of the chest wall, the patient is no longer able to breathe on their own and will die.
Dr. Mcpherson told us her numbness had spread up so far that they were having to test Tammy's breathing every 15 minutes because they worried that she would stop breathing.
She was just laying there, and of course there was a lot of prayer going on for her at that time. So I had hope that she was going to get better, but right then you couldn't hardly see it. She was hooked up to heart monitors and oxygen, and she was just hooked up to so many things, and it scared me to death.
Just 1 week ago, 25-year-old Tammy Gilliland had a simple case of mono. Now she's hovering between life and death. Tammy has just been diagnosed with ADEM, acute disseminated encephalomyelitis, an extremely rare disease that has already paralyzed her from the chest down and is rapidly moving up her body.
I was totally out of it and just in complete survival mode, and not even conscious survival mode. I think that I could have gone to sleep and never woken up again and not known the difference.
After I had established the diagnosis of ADEM, I knew that the patient was at high risk for complete paralysis and loss of ability to even breathe without life support. And I knew that we had to act quickly to keep the patient alive. At the time that the diagnosis was made, there really was no known treatment. So throughout that night, I did research and found a lot of evidence supporting the use of high-dose IV steroids.
Dr. Mcpherson immediately starts Tammy on the medication. But there's no guarantee the treatment will work.
was important to notify the patient and the family of what this could possibly mean. And while that's difficult to tell a patient that they have a serious neurological problem while they're laying in bed paralyzed, it's something that's necessary.
Dr. McPherson said the nervous system can be very fickle, and what nerves decide to come back and function properly. So we knew that there were a million different scenarios that could happen with Tammy, and we just didn't know which one to expect.
Within hours of starting the IV steroids, her sensory exam started to already show improvement. The tingling and numbness started descending as she started to be able to feel things further and further and further down.
And then, very slowly, I could feel, again, my midsection, I could feel it. And then I could feel my thighs, and then I could feel my knees. And it was just such a relief to feel like, okay, this is gonna fix this thing.
Within 5 or 6 days, the patient was pretty much clear of her acute illness. She had lost a lot of muscle. Her nerves no longer knew how to control the muscles, and she was then transferred from the hospital to the rehab facility in order to get further treatment.
Tammy didn't have a lot of strength. It was almost like her muscles just were non-existent.
I had hours of physical therapy, and initially it was just working on the ability to stand, and then it was taking steps. I remember the first step was just such a triumph. Just being so excited and thrilled that that hurdle was crossed.
Finally, after 2 long months of intense physical therapy, Tammy returns home.
It was so fantastic just sleeping in my own bed again. Being able to be out in the fresh air, and being able to ride in a car and have my normal life back.
It was so good to have Tammy home. That's when I knew. I was like, okay, we're gonna be fine.
While the family is ecstatic that Tammy is walking again, they can't help but wonder why the lethal disease wasn't diagnosed before the paralysis set in.
Initially, Tammy's symptoms indicated just a common viral illness, and the progression of her illness that was quite rapid indicated that she had something more serious and rare going on. Acute disseminated encephalomyelitis is very rare. It affects about 8 per 1 million people per year. And this was my first case of actually seeing ADEM, and I still have not seen another case.
Today, almost 12 years later, Tammy is 37 years old. She's extremely grateful for her family, the greatest joy in her life.
I ended up moving back home to Colorado, and I met my husband, and now we have our daughter Olivia, who is the light of my life. We bought a house a couple years ago. Everything really has just worked out phenomenally.
Tammy today is just great. She married a wonderful man, and she has a beautiful daughter. I think when you've been as sick as Tammy was, you don't take it for granted. Every day is something really special.
I could not have made it through without my sister Julie and my mom and dad. There's no way that I would have made a recovery at all, The experience of the illness really has just changed me. If somebody had told me when I was 23 or 24 that I would go through this and come out on the other end and, feel so blessed and so just successful in life in every way, I would never have believed that I could even make it through that illness. So just to know that I have that kind of inner strength and fortitude is, it's awesome, and it really just propels me in life.
Next, Nadine Miller finds herself in a desperate fight to keep her family together as she begins to go blind, and no doctor can tell her why. In 2008, 43-year-old Nadine Miller was living her life to the fullest in Detroit, Michigan. More than anything, she and her husband loved watching their 2 teenage sons, Joshua and Daniel, grow up.
My kids are my life, and there's nothing more that I enjoy doing than getting in the car and taking them somewhere. We go places like the Science Center, birthday parties, programs at the library, the symphony, the museum.
Nadine, she's the love of my life. She's very intelligent, good wife and mother. Nadine had a very good work ethic.
I worked in the scheduling office of the facility that treats cancer patients. I enjoyed doing what I did. Never missed a day.
Life is good for the Miller family. But in the fall of 2008, Nadine begins to slowly realize something strange.
Towards the end of September, I'm really straining to see. When I took the eye pencil or the lipstick and tried to read the color that it was hard for me to see. And I noticed that I had difficulty putting on my eye makeup.
When we received mail, she would have to really squint really hard in order to see it. Anything dealing with reading, she had difficulties with.
Alarmed by the sudden change in her vision, Nadine checks in with a local eye doctor.
I told the receptionist at the desk I have an appointment with the ophthalmologist. Mind you, I can't see well enough to even sign myself in. I told him, I said, I'm having difficulty seeing. My vision is going out. I can hardly see you. I don't know what's going on. The doctor then checked my vision. At that point, he said, I'm gonna order an MRI for you. I called my husband and said, I don't know what's going on.
I just thought it was just something short term and that it would pass.
Nothing could have prepared Nadine and Willard for what the test reveals.
The MRI showed some abnormalities, some inflammation of the optic nerve, which could indicate sarcoid in the eyes. I was very scared.
Sarcoidosis causes swelling in different areas of the body, most commonly the lungs, eyes, and skin. In severe cases in which the eyes are affected, patients may lose their vision.
I was terrified. My wife is only 43 years old, and for her to contract something like this now is very frightening. I was terrified.
You think, God, not me. Am I going blind?
Just 2 weeks ago, Nadine Miller's vision started to rapidly deteriorate. Now her doctor believes she's suffering from sarcoidosis, a condition that's causing acute swelling in her eyes.
It's just a sad feeling for me to see my wife like that. She could not see people's faces.
In fact, Nadine's case is so severe, it's imperative she undergo a round of intense drug therapy immediately.
I was in the hospital for 4 days, getting a dose of steroids every 12 hours. And by the 4th day, my vision was very clear. It was like back to normal. The following Monday, I returned to work, business as usual.
She could see, she was happy, her spirit was uplifted, and she could read again. She was normal, and that was a great feeling.
While the doctor is hopeful that Nadine is in the clear, he warns her that sarcoidosis is unpredictable. It could come back at any given moment. And sure enough, just 2 weeks later, Nadine is faced with a frightening relapse on her way to work.
It started to get very difficult to figure out the color of the traffic lights. So I tried to avoid that by just getting on the expressways. Even if the expressways were jammed, I would still get on. I just stayed in the slow lane. All I can say is by the grace of God, I got to work. I told my supervisor, I said, look, I got to go to the doctor. My vision is diminishing.
I had to go to her place of employment to pick her up. She came out the door, And she literally almost got into another person's car. And that was really scary. So then we rushed to the hospital.
Once again, Nadine endures another high dose of steroids.
Upon discharge from the hospital, my vision returns to normal, sharp and clear. But instead of the steroids lasting like they did when I had my first attack, the steroids are starting to lose their effect.
And when Nadine pushes the doctor to rethink the treatment plan, he encourages her to give the steroids a chance to work.
I would think that the doctors could figure this out. I'm starting to get a little impatient. I'm angry, and I was dependent on people. We've always had reading time together. I said, Mom's not able to read this, so why don't you read it to me?
Her vision was getting worse. She was not allowed to drive after that point. Everywhere she had to go, I took her there.
I'm in my 40s. I'm not supposed to stop driving.
So I had to take over. I cooked for the boys. I took them to a bus stop, helped them with their homework, and did all the things, well, almost all the things that she did. But I couldn't do them nearly as well, of course. And it was really becoming frustrating for me because I had never been in that role before. But even more important, I really felt for my wife.
I guess I felt like I lost control, you know. You feel like the rug was just pulled out from under your feet.
Over the past 6 months, Nadine Miller has been slowly losing her vision. Her doctor is confident that she's living with sarcoidosis, a chronic condition that seems to be destroying her eyesight. But just when Nadine begins to wonder how much more she can take, a terrifying new symptom begins to emerge.
I get up to use the restroom, and I go in the kitchen, and I'm seeing all kinds of colors. When I opened up the refrigerator, I'm seeing just blobs. It appears as though they're floating all over the kitchen. And I'm crying and screaming.
Horrified by the bizarre visions, Nadine and Willard rush to the hospital. An hour later, the on-call doctor orders a series of tests, hoping to pinpoint what caused the mysterious hallucinations.
And they said, well, we've checked everything. The only thing we could do now is make a referral to see a psychiatrist. I was very hurt by that. I felt that no one believed me.
When the doctors didn't know what was wrong, I know she had to really feel frustrated and upset and just terrible about the whole situation.
Unsure about what to do next, Nadine does the best she can to grin and bear the frightening visions that seem to come and go at will.
I tried not to even look out the window because every time I looked out the window, I saw something that just was not there. It was very difficult to get through days like that.
Overwhelmed, Nadine begins to call in sick on a regular basis. It's a trying time for the family, especially since they rely on her paycheck to help cover the bills.
They told me that, Nadine, you're gonna have to stop working. We're gonna place you on a disability simply because you're unable to do your job. I wanted to cry, but what could I do?
It was very difficult for Nadine to be told that she could not work anymore. She was a good worker. Her sight was that bad where she could no longer do it.
Desperate for answers, Nadine schedules another appointment with her doctor, and she urges him to reconsider his diagnosis.
The doctor did say that we don't know if we have this exactly figured out, and he ordered an MRI. Once again, the MRI showed some type of inflammation.
This time, the amount of swelling around her optic nerve and in her brain has doubled.
And at that point, he didn't know exactly what was going on. I agreed to have this biopsy of the brain to find out exactly what was triggering these attacks.
But the procedure, called a craniotomy, is a gamble. There's no guarantee that they will find anything, and there's a high risk of brain damage.
When Nadine went in the hospital for her craniotomy, I was very nervous and I was very concerned about her.
My family, they were scared because they thought, this is my wife, this is our mom. Are you going to be okay? I was nervous. Will my vision come back?
Over the past 6 months, Nadine Miller has lost most of her eyesight and is now suffering from frightening hallucinations, despite repeated steroid treatments that should have helped. At the end of her rope, she has agreed to undergo a dangerous brain biopsy called a craniotomy.
The craniotomy would involve making an incision down the side of my temple and opening up my head. That was scary.
On the day of the surgery, Nadine bravely heads into the OR, where Dr. Robert Tomczak and the medical team take over.
The decision to do the craniotomy in Nadine's case was difficult because it potentially can have serious complications, including death.
Any intrusive surgery like this is very serious. I was scared. I, of course, waited in the surgery waiting room.
After 3 long hours, the doctors pronounce the craniotomy a success, and the biopsy sample is sent straight to the lab. 3 days later, the findings are in.
Based on the results of the pathology test, Nadine was diagnosed with chronic relapsing inflammatory optic neuropathy.
Chronic relapsing inflammatory optic neuropathy, or CRION, is an autoimmune disease that affects the eyes. Normally, the immune system helps to keep infections or any foreign elements in check. But in patients like Nadine, for some unknown reason, immune cells, called B cells, attack the optic nerve. The result is severe inflammation that causes vision loss.
CRION is presumably an autoimmune disease. The body, for whatever reason, starts fighting its own healthy tissue. Inflammation is a general term to describe what the body does when it's injured in some degree. So an example that would be easy to understand would be if I were to accidentally hit my thumb while hammering a nail. We all know what happens. My thumb would swell, and that is really an inflammatory response. So this can occur in virtually any part of the body. In Nadine's case, the inflammation affected the transmission of nerve impulses in her optic nerve. And as a result of this inflammation, Nadine's vision was impaired.
I've never really heard of Crion's disease.
It was relief to know that they have a name to something that I have.
It's now all too clear that Nadine's vision problems, including the hallucinations, were a direct result of her condition.
Chronic progressive visual loss is really the hallmark symptom of this type of inflammation. Visual hallucinations come in a number of different forms, but basically the brain is being deprived of its normal visual input, and then it starts to sort of make up things on its own. The major effect is blindness. If the inflammation ultimately starts killing off the optic nerve fibers, then blindness would be the worst complication.
While there is no cure for CRION, it can be treated with an anti-inflammatory medication. And within 6 hours of receiving her diagnosis, Nadine begins the first course. But CRION is such a new disease that Dr. Tomczak can't predict the outcome of the treatment.
The progression of CRION is not known in terms of long-term prognosis. It was originally described in 2003.
My biggest concern was, what if my vision doesn't return?
I was optimistic that she would get better. I had faith that she would be all right.
Almost 3 months after beginning the medication, Nadine's vision starts to gradually improve.
I try not to get frustrated about it. I concentrate on what I can do, not what I can't do.
While Nadine is grateful to finally be on the road to recovery, she can't help but wonder why she had to lose most of her eyesight before landing a diagnosis.
Nadine's case is very uncommon, and there are probably less than 25 cases reported in the medical literature.
Today, Nadine is starting to feel like her old self and is without a doubt optimistic about her future.
I have IV treatment every 6 months. I can say that I am improving. I'm reading. I don't read a lot, but I don't have blurry vision like I used to. I can distinguish colors.
I see our life coming back to the way it was before. Nadine really has improved. She's now on the level where she should be, where she can do the things that she used to do.
Our vision is something that we take for granted, and when you find that you have to depend on other people, it's a humbling experience. And I'm just a lot more sensitive to other people and their needs than what I was before.
I love her, and she's really been very strong going through all the things that she had to go through, and that I'm always here to help her and support her in any way that I can.
My husband and children were very helpful and very supportive. It was difficult, but they hung in there, and I'm very proud of them. They helped out a lot and couldn't have done it without them.